I used to would say a long time ago, take a few extras, but this day and time, if it's chargeable or items that go in the patient's room don't need to come back out because of infection control. So you really need to think ahead of time what you need, okay? So we know that we're gonna do a Foley catheter. So we gather our supplies, we come in, wash our hands, we identify our patient with 2 identifiers, just like always. We say, Mr. Jones, okay, my name is Lisa and I'm your nurse today. And the doctor's ordered for you to have an indwelling catheter. That's a catheter that we put in that stays, that'll drain the urine out of your bladder. And what's the most common question anybody's gonna ask? Is it gonna hurt? It may be a little uncomfortable when we put it in, but after that, it should not hurt, okay? What else might you ask if you were the patient? Can you think of anything?
Are you in any pain?
Are you in any pain? Is it okay?
When's the last time you peed?
How long will it be in? And that's a great question. Sometimes we don't know. We used to put Foley catheters in everybody that was in the bed for a few days. I'm just being honest. Everybody got one. That is a no anymore. So it's not that often that you see too. A lot of people go to surgery and get a catheter put in. It'll come out right after surgery. I assume still on C-sections you get one overnight, maybe if they're good to you. So anyway, those are various things. So explain the procedure. So you gather your equipment. It's real important. This is a what kind of procedure did we say?
A sterile.
A sterile. So I'm also going to explain to my patient, when I do this, it's a sterile procedure. So I just need you to understand, I just need you to be as still as possible, and I don't want you reaching over and those kind of things. I try to always educate them because they don't know, or whatever. So that little lady be trying to help you, you like, stop that, okay? So that's what we do. Now, what's next on your list? Okay, provide privacy, no doubt about that. What else? Position and drape. Okay, so is there a sheet anywhere? Just take a sheet off of one of those beds. Give that draw sheet off that one, please. So, because my patient doesn't even have a sheet.
You want this, the white one?
Just a draw sheet, white one. Just that sheet. Okay, so does it say any specific type of drape? Did y'all talk about drapes in class? Y'all ever heard the word diamond drape? Have any of you women ever been to the gynecologist? Okay, they used to do a diamond drape. Okay, a diamond drape was 4 points, turn the sheet sideways.
Oh,
okay?
Yeah, they still do that.
You wrap 1 point around this leg, 1 point around this leg, and you have a flap that folds up like this. It is probably, while y'all are practicing learning, the simplest way. Males, we just simply fold a regular sheet, and I would put a sheet up over the abdomen like this and like this, okay? So it doesn't say anything specific about covering them up. Okay, so I'll have that conversation. The diamond drape causes people lots and lots of stress, and it's really not worth that amount of stress. You just keep your patient. But remember, the female, what position are they going to have to put their legs in? We're going to get
like
them
a butterfly.
To do this, okay? And so the reason we have the diamond point drape is for that privacy thing. So let's pretend like this. So you hold that corner right there, okay? And this point is going up here. And then this point is going right here. So the way it works is, here's the point of the sheet right here. So we wrap the leg up like this, okay? And that's to provide you some sort of privacy, okay? And everything's not exposed. Then you do the same thing on that side. Wrap that leg up, under and over, okay? And now, let's get them to put their legs up. And you got this flap right here, if you will. Do you see? So you got legs kind of covered up, okay? That's the premise of it. The bottom line is they got to be draped in some fashion, and our sheet can't come into our sterile field, okay? So we're providing privacy as best as possible, okay? So what's next? Put on clean gloves and do perineal care. Why would we wash the patient before we do it?
To make sure it's as sterile as possible.
Make sure you don't introduce gunk into it when you put something, because this is a foreign object going into the body. So we do perineal cares. We put our gloves on, we get warm water or wipes or whatever, and we clean the appropriate way. How do you wipe a female? Front to back, that's exactly right. So we do perineal care on the male, you know how to do it, okay? So then we go pour that water out, wash your hands, those kind of things, and everything's good. Does that make sense? All right, what's next? Open the catheter kit. So look, this is important to pay attention to. When you get your kit, it says 12 French, that's the size of the catheter. Then it says 5 milliliter Foley catheter with 2,000 milliliter drainage bag. Okay, so 5 milliliter Foley catheter. That 5 milliliters is the balloon that's going to hold it in. You'll have to document this part. That's the reason you don't throw this little piece of paper. You need to know that it's a 12 French and how much fluid you put in the balloon. Okay, so that's one. So how do I open a sterile package? The exact way it comes to you. So these all get a flap like this. Okay. So now can I reach in and get the package? Of course I can. It's the only way you can get it out, right? Okay, so there it is. Anywhere on the outside is contaminated because we have to get it out of the package. Would it have done any good if I put sterile gloves on? I could have got it out with sterile gloves, but my sterile gloves would be, and I wasted $80, okay? So, now, there is a trash can on anybody's side? Okay, so before I would have washed and all that, so there's two things you can do. Just a trash can, I always put it by me. Then there are going to be those that are going to show you to make your bag a trash receptacle, okay, just like this, all right? And you put it down here out of the way. All right, let me explain this. You know when I'm doing anything and I'm ready to throw it away, once I become sterile, I've got to keep my hands above my waist level. And if I want it to go in that trash can, all I can do is bring it here and do what? Drop it, okay? Now, I say, well, I'll just put my swabs when I clean in this bag right here. That's all well and good if you get it right there and chunk it in. But if you put your hand all over this, it's contaminated. I've seen more people sweat and cry over this silly bag. So get it wherever you need to go. But the worst case scenario is it drops on the floor, it's somewhere. You're going to clean it up when it's over. Try not to freak out about that, okay? But it causes a lot of grief, okay? So now I'm ready to open my sterile fill. So what do we know? I've always got to keep my sterile fill what? In my view, right? And so can I turn here and here? Yeah, I have to be able to do both. So I see it right there sitting, okay? I might put on extra gloves over here, but the bottom line is I got to keep it in my field of vision. So you got it opened up right here, and you've got this piece of paper right there, and this is if you get a, this is where you can put the date and your name and put it on the little tube. So I'm ready to open my package. Some people will show you they open theirs on the overbed table. I never have. I like to make my sterile fill right here, okay? So let's do it here. Now, let's think back and review. How do we open a sterile package? Way. Okay, now everybody look. The first one is tucked in. So should I reach my hand all the way up under there? No, what should I do? Just take this right here. Everybody gets so you can see, okay? And look, there's the flap. Now, I think I told y'all in class, so what do these things like to do? They like to go back. So which one, what do I do now? I open it just the way it's packaged. So look, there's a flap, okay? All right, now if this starts acting crazy, I just reach up just like this. Can I do that? Yeah. Sure I can, because I'm not reaching over the field. And then I do the next flap, okay? And then look, this one, I just reach right here and get it, okay? So there's my sterile fill. So there we go. And if I don't like it, I can do just like this, if it flaps back on me. Okay, I believe in working with a kit that's packaged. Why fight it? So the very top thing right there is a pair of sterile gloves. Everybody kind of agree that's what that is? So I got to get those sterile gloves out of there, right? And I got to put them on. So where can I get that package at? I can only touch it on the sides. Can I do this? No, I've contaminated. Can I do this? No. So I got to reach right here and be patient to get my gloves, okay? And then what do I do with this little thing? Okay, I can put it right here. And now I've got to put on my sterile gloves. Now, there's some people that maybe have done this before that are going, well, you could put this drape down without putting sterile gloves. You can, but it's just simpler to work with it the way it's packaged. So go ahead and put your sterile gloves on. Now this is where you want your name lanyard out of the way, you want your hair away from your face, I need to push my glasses up to start with, all those kind of things, okay? And then we get this little pair of gloves that are ironed together, okay? Now, you see my fingers are touching all on the inside, right? But I'm not gonna go over there with my glove, all right? So which hand do I glove first? My dominant hand, and I'm right-handed, so we're hoping this is the right glove. Now, where can I touch? Everybody come. Where can I touch on this glove right here? I can touch right here, right? Because that's the inside cuff. So see, I get my hand in before I go, and then I lift straight up in the air. And then I do just like this. And I'm patient, and I go, please, don't know if I can get my big hand in here, but we'll give it a sporting try, okay? Now, if you know that your hands aren't gonna fit anyway after you practice, and I put a hole in, so if you did, I would say, what are you gonna do? And you'd say, get another pair of gloves, okay? So I've got that, we're gonna put nothing up there, okay? If you know you can't wear these gloves, that's when you'd have your gloves, a separate package, and you'd open them and put them on now. Does that make sense? Okay? And then where can I touch this glove? Anywhere I want to, okay? So, but I can't touch my gloved hand to it, so I get it open, and then I try to ease my hand up in there. It's a lot easier if you'll take off your rings, if you've got anything that's gonna get in the way, okay? And I let it go. Can I go back and fix this? No. Can I go anything? No, leave it alone. If you gotta do anything, do that right there. Now watch, nobody cares about that paper. Y'all will be stressing out, be shaking. Throw that paper away. You get this white with it, leave it alone, okay? It's just a piece of paper. All right, now, what can I touch? Anything that's sterile, okay? So I got a drape, okay? So I pick up the first drape and I look at it, all right? And I got it up above my waist. If I do something wrong, y'all tell me, okay? And I unfold this drape, making sure it doesn't slap on my wrist or anything. And usually there's a shiny side. This is kind of the shiny side. It goes down. What is the purpose of this drape right here, you think?
This one has a hole in it.
It's to make my sterile feel bigger. That's the only purpose in it, okay? Now, some people are gonna say you have to do this, and you put it up under the patient. So here's what you do right here. Do you see how I've got my hands on the sterile field? Look, because this is where y'all will contaminate, okay? So I've got it basically under there. It's not the be all end all, okay? I got another drape. Let's see what it is. Guess what? When I undo it, it's got a what? It's got a hole in the center. And then it's got a shiny side, okay? Almost. They look the same on this one, okay? This is called a fenestrated drape. It's got an opening in it. There's two ways you can put it down if you choose to. Now look, I've got sterile gloves on, right? So if I'm taking this, I'm gonna do it just like this. Look how I'm protecting my gloves. Do you see how I'm protecting them? So when I put it down, or I can hold it by the corners or whatever. But the bottom line is I can't touch anything once put it down that's underneath. So I just put mine down like this, okay? But look, I'm still in control, right? I don't let it loose. I'm gonna be in control of whatever I do, okay? And so then I just leave it like that, okay? So I got my hands up, still above waist level. So what's the next thing I gotta do? What I do? Organize my supplies on the field, okay? So I use just the way it was. And then I've got swabs, okay? So these swab sticks, so you go ahead and open them, just like this, okay? Are they sterile where I'm touching it? Yes, because they were missed. So look, I can chunk it in the bag, it missed, who cares, okay? So then I get my little swab sticks out. Now I would teach you just to take them out and don't fight with it, okay? I would do them just like that. Can I do this? Bingo, okay? So you got 2 packs of swabs if you need them. Most of the time, 3's enough for how we're demonstrating. Okay, what else is on the top of my kit? Let's see what's in here. Okay, I got a syringe, and it's got something in it, okay? So it's got sterile water to inflate catheter, okay? Does that make sense? So just go ahead and take the little top off of it, drop the top that right there. Now, what is this? What do you think this is? This lubrication. So I take this lubrication out and I tear it off, and I'm gonna do this one just so that
Okay, so now I have that little tray ready, my patient's ready.
So Now, I squirt this right there, and I chunk that out of the way, okay? Now, I need to go from here and see. Now, look, you can pick this up and put it wherever you like. You just got to remember, where's your border? Can I set this all the way back down there? I sure can, because I can't go down there and touch that corner anymore, right? Does that make sense? Okay, and then I do this. Now, what's next? I got a test tube in here. Why? That would be if I collected a sample, okay? We just drop it over there because I'm not going to need it now. Now let's check this out. Here's the Foley catheter itself hooked to the bag. Does that make sense? Okay, so this Foley catheter is in a protective sleeve, okay? You see that? Okay, so when I take it out of the protective sleeve, then it's game on to control this little wiggly thing without contaminating it, okay? So you can't just jerk the sleeve off because it's going to flop everywhere. So you see how I just work it down like this? And I get control of it, okay? And then I can do whatever I want to. I'm just going to do that, okay? So I am right here with this, and really and truly, read on the front of that if it says it's a pre-tested balloon. Read that piece of paper right there. Does it tell us that? This product pre-connected with a 5 milliliter balloon. It doesn't say, okay? A lot of them, so we'll clarify, but a lot of them say don't test it, okay? So we'll clarify that and see, because when you test the balloon, it's going to inflate it, right? And then you deflate it. Well, most of the new ones will say don't test it. You just put it in because you don't need to unwrap it and rewrap it, okay? But if you tested it, so this is where you would hook up your syringe, okay? So look, you have a side port right here. Does everybody see that? That's a side port. That's where this is going. So this is called, you don't know this, but this syringe tip is called a slip tip, okay? Slip tip, it's straight. It has the opposite of that is a lure lock. Any of you that know what I'm talking about, lure lock screws in. This slips in. This is easier to come undone. So you slip it in just like this, and I make sure it's in there good. If it said test the balloon, and we'll clarify, that's when I would inflate the balloon. Okay, and it said it was a 5 cc balloon. This has got 10 in it, so I just make sure it's inflated good. And you're checking to make sure it blows up, doesn't have any leaks. Okay, and if it's okay to check it per manufacturer, then it's okay. So I gotta bring it back down. Okay, so you just kind of slowly pull it back. I'm thinking that the ones y'all have maybe are pre-tested, but we'll clarify. So see how I get all that in there? But I leave this attached. Don't take that off. So I've still got this sterile, and so I like to get everything ready. So here is where I choose to lubricate my catheter. Okay, now lubricate for a female doesn't need as much as a male, right? That makes sense. But I lubricate mine. Now your jelly sometimes will keep it in place right there. See? Okay, and sometimes it won't stay in place. Ideally, you want to leave it like this, but if it wouldn't stay in place, just simply do like this. Yes, it will get jelly on your tubing. Who cares when you get through? You wipe it off. But if it'll stay in your tray, just leave it in your tray. Okay? So what you got to do at this point is think, have I done everything I need to do before I touch the patient? Because once I commit this hand, it becomes contaminated. I can't move it again. Okay, so if I forget to hook this up and I have to do it one-handed, sweat will be pouring down you on your competency, and your hand will be doing like this and whatever. So always look, have I done anything I can do? All right, so I tell the patient I'm fixing to clean. So non-dominant hand, so on the female you spread the labia, and it's just darn near impossible to spread on this one, okay? But you spread the labia and I'm ready to clean, correct? Hey, where do I clean first?
You don't want to go too close.
Where do I clean? So I'm cleaning
away.
Huh? Okay, so furthest away. So this is the side, middle. Okay, because that's the way, okay. So here I would clean this, and here I go. Except it's spread and it would really be like this. Okay, one swipe and that's it. Now, to throw this away, do I do this? No. So I deliberately bring it like that, toss it down. Okay? Now, where do I clean? This side, closest to me. Do the same thing, okay? Now clean down the center. And I do that one, and I do that. Okay, so clean. And I can't let go with this left hand. And on a real person, y'all, it's slippery. Okay, it's slippery, it's wet. Okay, it's not easy to do this, but this one's easy. So now I'm ready for my catheter. So I just take my catheter and bag and do just like this and give myself some leeway. Okay, as long as my catheter, the tubing I'm not overly concerned about, it's the catheter. Okay, what am I going to tell the person? Okay, take a deep breath, and I'm going to insert it into the urethra, okay, not the vagina. Okay, look, everybody watch. My fingers, this is important, my fingers on my right hand should not be touching the patient. Does everybody see that? Okay, so we just keep going in from out here. Now on these mannequins, sometimes they'll go and sometimes they won't. Okay, so how far do I go for a female? Is that what your checklist says? 2 to 3 inches. And then most likely I'm going to see urine. Now somebody point to where I'll see urine at, please. Not there. Well, yeah, but you'll start seeing it way back there. Okay? So when I see urine, what do I do? Okay? Advance a couple of more inches. Okay? Does it say?
It is 1 or 2 more.
Yeah, okay. So I'd advance 1 or 2 more inches. Why?
To make sure it's in place.
Make sure it's all the way in and not in the neck of the bladder, okay? So let's say I push and I got urine flowing and I get it where I want to. Now here's the tricky part, okay? So I'm through with the sterile part. Does everybody agree? Okay, the sterile is inside the person. So I take my non-dominant hand and hold. Don't ever let completely go of the catheter, because you will, and they'll sneeze, cough, move, or anything else, and where will your catheter be in a split second?
Out.
Laying right out there. So never let it be free of hands. So I've got this, so what's my next step? I gotta inflate the balloon. Okay, now look y'all, this is a balloon that does like this. You can't hardly do it one-handed. So this is what I just always teach my students. The sterile part's done, it's in the patient. I just bring my hand up just like this and anchor. And then I inflate. Now, it's not a good idea to inflate on these mannequins, but you need to practice it, because here's the problem. You see me inflating? Okay? I'm inflating. And so watch. If I let go, what's going to happen? It's going to go back up. So the trick to this is I've got to inflate and take off. If I let go, it's going to come right back out. So what's the next step we do? How do we know it's going to stay?
You yank on it.
Not yank is never a good word. What would you do? Give me a better word.
Like
Gently tug.
Gently
Okay,
tug.
Never yank. Never yank. Okay? So you gently tug. And so when you do, if the balloon's holding it in place, then there you have it. Okay? Is the sterile part done? Yes, now it's clean. What do we do next?
Anchor to the limb, right?
Okay? What does it say? Does it tell you on your steps?
Yes.
Hold the catheter in place.
We blew the balloon up. What's next?
Stabilization device or tape.
Okay, so we've got to stabilize it. So nowadays we have these lovely little devices that you put on the leg, and you lay this over it and you clamp it over there or snap it over, or just good old-fashioned tape works also. Okay, so we've got this here and we tape it. Let's say we've secured it. Now what do I do? I got to get the bag. Do I hold the bag up like this? No. Bag's got to stay what? Below the patient. So I would do this one just like this. What does it tell us next to do? Pretend like this is secure. Okay, got it? I would never let go if it wasn't secure.
Observe character, clarity, and amount of urine.
Observe character, the amount, all that. So describe what you see is what it's telling you. So we need an amount, we need the color, we need, is it clear, does it have sediment in it, all those kind of things. And then where do we put this bag? Down. And where can we hang it at? On the bed frame. On the bed frame. It can't be anything that'll go up or down like jerk with the side rails, okay? So we hang it down, and what do we continue to observe for? How much urine comes out. Does it address how much urine comes out on here? No. Okay, I'll just tell you this. In real life, when you're putting this in, you watch and see. In other words, I hang it down over here, and while I am cleaning up, find a place on this bed, while I am cleaning my patient up, I'm watching that urine bag. Sometimes the book used to say, and I didn't teach elimination, so I haven't read it, y'all have, but used to it would say, if they empty out over 800 milliliters of urine fast, like while I'm cleaning up, that bag is full, sometimes we'll clamp it off, because pulling off so much fast will make you have a bladder spasms. Anybody ever had bladder spasms? They are so painful. So we watch that amount to make sure it doesn't get too much, okay? And then we just clean our patient up, okay? So we would just tear this away, clean it all up, take our gloves off, wash our hands, make sure our patient's covered back up, safe and sound, bed in lowest position, call belly reach, side rails up. Did I miss anything? Okay, so that's how you do it. Now, the difference, I want to show you one thing, okay? Well, here, let's just say how to remove a Foley. So if you have a healthcare prescriber order that says remove the Foley, what do you do? Explain to the patient what you're doing, gather your supplies, wash your hands, what do you do? What's it say? Does it say we tell the patient what we're doing?
Yes.
Yes, we're gonna take this Foley catheter out. What else?
Right here.
Perineal care before you start, before you take it out, make sure everything's clean and good. And then the bottom line is you have to deflate the balloon. So you get a syringe, not with a kit, just a syringe in the supply room. And you come back and you hook it up right here. And then and it'll deflate itself, but you always watch for the fluid to come back and make sure it's completely back. Once it's back, you simply come up here and you slide it out. Okay, that's it. Now, what would you do with this catheter and all this? Biohazard bag. What would you do with the urine in the bag?
Measure it
in the
in.
bathroom, measure it, and then dispose of it all, okay? Make sure your patient's clean, dry, and comfortable. Does that make sense? Mm-hmm. And you would record any amount, all those kind of things. One thing I want to show you different before you start practicing, okay? On the male. All right, so important part here. So when you lubricate the catheter in the tray, you need to lubricate further, because it's going all the way into here. Oh, you believe that? Okay, so lubricate your catheter further. Okay, so let's pretend we got everything just like we did. Our catheter's in the lubricant, and so we're ready to clean. Now, it matters whether they're circumcised or not. If they're uncircumcised, you know, the foreskin is down on the penis, so you know you need to retract the foreskin to clean. Okay. It is imperative after you clean and put the catheter in to pull the foreskin back down. Okay, that's imperative. If they are circumcised, you don't have to do this. So this is a circumcised male. What angle does it tell you to hold the penis? 90 degrees, okay? So we don't put catheters in like this. We put catheters in like this. So to clean, how do we clean the males? Okay, where do we start?
Inside out.
Okay, so we start right here at the tip. And look, we do circular motion just like this. And when that one's done, I dispose of it and I get another one. Okay, I go back to where I left off and like this. Does that make sense? Mm-hmm. And then I get another one and I go like this. Never letting go with my non-dominant hand. Never. Okay, so then I'm ready to insert it. So to insert it again, the book will tell you that you go probably 5 to 7 inches is what that says. 7 to 9. And so basically, you're seeing urine pretty much by probably right now. Sometimes these will go, sometimes they won't. But look, I'm feeding that in all the way. You think it's uncomfortable? It is. Will they be screaming sometimes? Yeah, you just got to stay calm as a cucumber and say, keep breathing, okay? This one won't go any further, but you take it all all the way to here. Okay? Why do we take it that far? Well, number one, the male urethra is a lot longer than female urethra. And number two, when you get it where you see urine, if you stop right there and you then hold and come to inflate this, you may be getting urine, but you may be right at the male prostate. So when you blow this balloon up, it puts pressure on that. And then you'll get blood produced, and you look down and you got bloody urine everywhere. So that's the reason it's taught to go, we say go to the hub, okay? Because when you get it to the hub, it's the truth. I've been putting them in all my, I can put a catheter in anybody, okay? So when you get it to right here, you're gonna stop and do the same thing about inflating. Okay, and then remember, hold on to take this off or it'll come back out. And when you do that, you know how we said we're going to use what word?
Gently tug.
So you're going to gently tug. On a male, it's going to slip back out a little bit. That's just normal. But if the balloon's inflated, it doesn't matter. The danger is blowing it up and causing trauma to the prostate. That's why you do it. That's evidence-based practice. Find any Euro guy that does this all the time for males, and that's what they tell you. So that's what we do. Okay.
Is how much you put in with the inflating the balloon different for a man?
It's whatever the kit tells you, and this was a 5 milliliters. So really, this one would just take 5 milliliters. Okay, that's what that would take. I'm just gonna be honest now. You do whatever the package says. I'm gonna give a little bit of extra. Just a little bit extra to make sure my balloon is fully inflated. But remember, you have to push this in and take it off at the same time. And then this is where you just gently tug. And on a male, it's not going to stay up to there. It'll come back a little bit. Okay? Then you're going to do the same thing. Secure it, and then put the bag down and do all those things. Does that make sense? Okay? So, that's that.
When you get ready to take it out, can you show me how you, because it's so long, can you show me
how you take it out?
When, I know sometimes like they grab them and, fold it while they
so I would put my syringe, if I was taking this out, I would put my syringe on and deflate my bulb, make sure it's deflated all the way, and just pretend it's all the way up here. So I just tell them, take a deep breath and blow it out, and I just ease it out just like this. And it's out. So anytime you're removing one, you just tell them, take a deep breath, now breathe. Don't get them to bear down, pulling out. Just makes it, they clamp down. Going in, a lot of times, the book will tell them to bear down a little bit, like they're voiding. And when you can't find it, it's easy to find where you're going on a male. There's only one place to go. Female, you got a vagina, you got a urethral open, and then when you've got them pulled back, you can see the little clitoris on a female, okay? So if you try tapping on that area, it's not going in, but it'll cause much pain to the patient, okay? They'll be jumping and twitching, okay? So, but if I go in so what do I do if I put it in and it's in the vagina? In other words, I put it in like I'm supposed to, I try to blow the balloon up, I never get any urine. It's in the vagina. What do I do now?
You gotta get a new one.
Leave it in the vagina, get a new kit, put it in, and don't go back in the vagina. You say, well, it can't be that hard. How could you miss it? Oh, trust me. Urethras in females will prolapse down into the vaginal area. So sometimes you will have to pull back apart enough that you see the vaginal opening. The urethra may be under it. Y'all, everybody's urethra on females are not in perfect alignment. Sometimes they're on the side a little ways or whatever. You got to look. Okay, you never guess. Know where you're putting it. And then if you tell the lady bear down and a little bit of urine comes out, it helps tremendously because you see where it's coming out. You think, okay, this is a no-brainer. You wait till you put some in. You'll be looking all over for that urethral opening, okay? So, anyway. Question? Who had a question?
Caitlin.
Yeah, but if
Oh, sorry.
For a female, do the urethra be like open, or you can see it open, or like
The opening. You look on your book on the little anatomy picture, and you've got a urethral opening. Just like if you could visually tell them to bear down and urine start coming out, you would see the urethra. So yes, you can see the urethral opening. But a lot of times, in a lot of women, especially after they've had children or they get old, it is not in the correct anatomy. So it will literally prolapse down into the vaginal area. So you have to really, I'm sorry for the inappropriate term, but you have to really get up in there. Yeah. And pull it apart. And your hand will get a cramp, y'all. Your hand will get a cramp from finding it and hold it because you can't let go unless you find it. Okay, sometimes you have to have help. You know, do you think when you pass this competency off in clinical, I'm gonna let you go do a Foley by yourself? Not in a million years. Not in a million years. It'll take me and you and another student to put the first few in, okay? Because it's just a big deal. But you can learn this skill, but you got to practice sterility. And if 3 of you are in bed and you put it in and you 2 are on your phone, y'all fail for me today. Because y'all got to watch every step she does, and then you got to watch them, and then everybody has to do it. That's the only way. Like, y'all are my clinical group. Y'all are all my clinical group. Like, don't listen if you're not my clinical group. So I want my group to be the best. Come back in the tubing. In real life. Yeah. But the key to it is going far enough the first time and then inflating the bulb. That's the key to it.
That means you're not far, you're not in far enough.
It could mean a lot of things, but you need to go till you can't go anymore in a male. That's the bottom line.
You'll feel it when you get, like when you.
Oh, you'll see it. Like it'll go literally up to here. And you can't go any further.
Every time for a male, you got to put out.
Go to the hub. 7 to 9 inches, but you go to the hub. It's what it's going to tell you in the book. I read it early this morning to make sure I was saying it right. But you're going to go to right there.
So
And
inflating
then
is just
after you inflate it, we'll slip back a little bit.
inflating is just to make sure you're at the right spot.
What now?
Inflating is just to make sure you're kind of at the right spot when you inflate, or is
Inflating is to keep the Foley in. If you don't inflate the balloon, the Foley can't stay in. Does that make sense?
Yeah.
Because if you didn't inflate the balloon, that slippery catheter would just go right back out. Okay? Right back out.
You don't know anytime, you teach anybody, they're going to get, they're going to eat up. So how do you do that? Like, how do you?
Are you asking about a male having an erection? Okay, so it's a good question. If your male has an erection, okay, it can happen just from stimulation sometimes, but you just are professional. Most of the time, by the time you start cleaning and stuff like that, it won't, because it's a fight or flight response, and they're going to clamp down on you and those kind of things, and that's usually not an issue. If it did and it deterred you going in, like you were blocked or whatever, you just have to stop for a second and see if it won't resolve itself. Most of the time, that's not an issue on males. I put in a mini male Foley, and that's really not a problem. Prostates are problems in males. They are problems in males. So anyway, that's how you put a Foley catheter in. So it looks like breezy peasy. It's not. It's probably one of your hardest competencies in nursing school.
Ms. Jenkins, when you say it slips out, how much will it slip out?
On the male?
Yes,
Oh,
because I'm a visual person.
It's nothing to be alarmed. So if you had it all the way
Yeah.
to here and you blow your balloon out and you gently tug, it'd probably come back that far.
Okay, see, I would
But
freak
you-
out.
No, because you've tugged and felt the balloon in place.
Okay.
But the reason it comes back out is not everybody's is
The same size.
But males, the problem, if you just go till you see urine and blow it up, that's when you get involved in the prostate and you traumatize it, if you will. And that's not good. Now, females some people are just so touchy about everything. So you got to remember, pain is relevant to your patient. It's not our perception, it's theirs. So some people, you touch them and they break out. Okay, you have to remain calm and professional. I know that's uncomfortable. Just lie real still or whatever. And then if you see them just going like that, you got to say, look, you got to breathe with me. Come on, let's practice breathing while I do this. Male, they're just gonna try to look the other way and pretend it's not happening, but it's uncomfortable, especially a male that's got any urethral strictures or something like that. It is uncomfortable. You just have to work efficiently and fast and get it over with. Pre-medicate, like IV pre-medicate? You're not. You won't get IV. But now I will tell you that sometimes if it's a problem going in, especially if we have to call the urologist, they will come in and sometimes they'll get us to put the tip of the penis like that. So, but no, you get no.
You don't get a
Y'all get
morphine.
morphine to put a Foley in a male. No.
They'll ask for it, but
So
Yeah.
if there is,
Don't
They'll ask me, but y'all won't give it.
It does, I can't say because I've never had a male one put in, but a female doesn't hurt at all. It's uncomfortable and it burns. Yeah.
It burns.
But it's whatever.
I feel you.
I'm not surprised. Because what?
so if they are uncircumcised when you're cleaning, you pull it down, then do this.
Like if he wasn't circumcised, so the foreskin would be like this, so I would pull it back and clean and put my Foley in. And then when I got everything done, I would make sure and pull the foreskin
Okay, so you don't
back
have
this
to
way.
clean the, like how far do you need to go on a man that's uncircumcised?
Uncircumcised, I pull it back, I would clean all the way up, just like 3 swabs, all the way around. Yeah. Okay? These other kits right here, okay, this is a Foley catheter without a catheter. So in other words, not everybody gets an indwelling Foley. So you could have one of these little kits where you just get a straight catheter itself. It's not hooked up to a drainage bag. And you have a container in here and you just put, so like it wouldn't be there. So you would just put the end of it in the tray that's sterile in there and let the urine drain out. That would be what we call an in and out or intermittent.
Okay.
Going in, draining the bladder, coming back out. And then this is a different rule. So y'all can open these, okay? But remember, it's sterile, okay? It's sterile. So you treat it the exact same way. You look, there's the first flap, away, side, two, okay? Does that kind of make sense? You won't know till you do. I suggest you take your lab coats off, all that kind of stuff. Get your stuff, get real, and let's get after it.
Can they refuse?
And they refuse.